Hello and welcome to this training video for lying and standing blood pressure. This training is aimed at all nursing and midwifery staff at Bradford Teaching Hospital's NHS Foundation Trust. A target was set in 2022 to reduce falls by 50%. This was achieved in November 22, but due to acuity, our falls figures have increased. This meant we achieved a 37% reduction last year. Lying and standing blood pressure is an integral part of the multifactorial risk assessment. Lying and standing blood pressure can determine if postural hypertension is causing a fall. This is a preventative test and should be performed on everyone at risk of falls on admission. All staff should be aware of the correct technique and understanding of why we perform a lying and standing blood pressure. This is an essential part of the multifactorial assessment for falls prevention and improvement. In cases where some of our patients had fallen, a lying and standing blood pressure was not carried out or not documented. This could have contributed to their fall. A drop in blood pressure can be common in older adults, and this is called orthostatic hypertension or postural hypertension. Causes can include dehydration, prolonged bed rest, taking diuretics, blood pressure medication, sedatives, hypoglycemia and uncontrolled diabetes, heart conditions, Parkinson's disease, hormone imbalance, infection. All these factors should be considered when completing your falls assessment. A falls assessment should be initiated if your patient is over 65, has a cognitive impairment, has reduced mobility or is unsteady on their feet, has a history of falls, is admitted with a fall or collapse with loss of consciousness, has reported dizziness, especially when standing or bending down. If a falls care plan is commenced, a lying and standing blood pressure needs to be completed. Lying and standing blood pressure should be measured in the morning, as this is when it is most likely to be present. It should be measured within 48 hours of admission. If there is a deficit, this should be monitored on 3 consecutive days or until this is resolved. When possible, please use a manual sphygmomanometer. If the automatic machine fails to record the blood pressure, a manual blood pressure cuff should be used. Here we will demonstrate how to measure a lying and standing blood pressure. Lay the patient on the bed for at least 5 minutes. Take the patient's blood pressure whilst they are laying flat. Assist the patient to stand up with help if required. Take a second blood pressure reading within the first minute of standing. Wait for a few minutes, then repeat their blood pressure. If at any point the patient feels dizzy, unwell, or they feel they may fall, stop the procedure. Please document that you have tried and inform a medic. A positive result would mean there is a drop of systolic blood pressure of 20 mm or more, a drop of diastolic blood pressure of 10 mm with symptoms, a drop to below 90 mm. If any of these are present, explain to your patient what has happened. Inform the medical team. Ask for a medication review. Ensure the patient is well hydrated. Make sure they have access to the call bell and explain the reasons why. Ask the patients not to mobilise without assistance and mobility aids if they use them. Thank you for watching this video. If you are viewing this video on ESR, make sure to click the blue house icon in the top right hand side of your screen to save your progress.